lost my license to practice law, spent my entire day and evening seeking drugs, using drugs, and finding more ways. Drugs are everywhere.
Drug overdoses are now the leading cause of unintentional death in the United States by far. That is why, effective today, my administration is officially declaring the opioid crisis a national public health emergency under federal law.
It gave me an opportunity to socialize and learn again that life can be wonderful without the use of drugs.
마약 문제 해결의 실마리를 찾기 위해 미국 뉴욕에 있는 한 약물 중독 재활센터에 방문 예약을 했습니다.
한때 마약 중독이었고 지금은 벗어나서 그 치료센터에서 다른 중독자들을 도와주고 있는 분이거든요. 저희도 어떤 내용으로 얘기를 해줄지 좀 궁금합니다. 미국은 우리나라보다 훨씬 마약 중독 문제가 심각하기 때문에 곳곳에 마약 중독자들을 위한 치료센터들이 있거든요. 이 센터 이름이 사마리탄인데 성경에 등장하는 이름이거든요. 중독 상태에 있거나 굉장히 어려운 사람들을 돌본다, 이런 의미를 담고 있는 것 같습니다. 저 말이면 사마리탄.
Sean?
Hi, yeah. Hi, nice to meet you.
Very, very nice to meet you. Harry Scott.
Nice to meet you. Hey.
My name is Harry Scott, an assistant vice president at Samaritan Daytop Village. I was a lawyer for 30 years before I came into treatment. I'm also a graduate of Samaritan Daytop Village. I was a client 15 years ago. My job is to help to run a number of our substance abuse treatment programs.
마약 중독자에서 상담사로 변신한 해리 스콧. 먼저 미국에서 마약 중독 문제가 얼마나 심각한지 물었습니다.
It's very serious. In 2018, approximately 72,000 people died from overdoses. $120 people each day die from an overdose. Think of an airplane with 120 passengers on it crashing every day and everyone dying.
2017년 마약 중독으로 숨진 사람 가운데 67.8%는 오피오이드 중독이 원인이었습니다. 같은 해 미국에서 오피오이드 오남용으로 사망한 비율은 96명당 1명으로 교통사고 사망 비율인 103명당 1명보다 많았습니다. 미국인들은 왜 이런 마약성 진통제를 사용하게 된 걸까? 오피오이드는 1990년대부터 통증 치료 목적으로 처방되기 시작했습니다. 당시 제약회사들은 오피오이드가 중독성이 없다고 광고했고,
Don't be afraid to take what they give you. 1% of patients taking opioids actually become addicted.
They do not have serious medical side effects, and so these drugs, which I repeat are our best, strongest pain medications, should be used much more than they are for patients in pain.
의사들은 마진이 많이 남는다는 이유로 처방을 남발했습니다. 마약에 중독돼 일상생활이 불가능했던 스콧을 구한 건 바로 약물 중독 재활센터였습니다.
The Samaritan Village saved my life, helped me address my drug problem.
Can you explain how you were able to free from drugs?
The treatment program, again, taught me ways to handle my negative thinking and my feelings. It gave me an opportunity to socialize and learn again that life can be wonderful without the use of drugs.
스콧은 마약 중독을 질병으로 보고 적극적인 치료를 통해 극복할 수 있도록 도와줘야 한다고 강조합니다.
It used to be thought of as, well, you're just a bad person. It doesn't mean I'm a failure. It means that I need more treatment. So treatment is important to address the disease. If I have diabetes and I don't get treatment, it's going to spin out of control and I'm going to die. If I have an addiction issue and I don't get treatment, it's going to spin out of control and I'm going to end up in jails or institutions or death. Our treatment process is designed to do a couple of things. The first thing it does is it puts you in an environment, in a place where you're separated from your drugs. The second thing it will do is give you an opportunity to stabilize, to work through your withdrawal if you have withdrawal symptoms. Then what you attempt to do is to educate the patient or the client about the effects of drugs and what drugs is doing to the body and how drugs have negatively impacted their life. Loss of job, problems for the family, inability to complete education. And you try to help them gain some insight in terms of what drugs does to them.
스콧이 부원장으로 있는 이 시설은 정부에서 예산을 지원해주는 비영리 단체입니다.
Does Samaritan Data Village get any support from New York City or the U.S. government?
Yes, from both the federal government, which gives money to the state. The state then funds most of our programs. New York City also contributes money towards food and shelter. So our programs are free. We are required by law to accept anyone that needs treatment, regardless of their ability to pay, and the state pays for it. And even now, and more recently, insurance companies in the United States are required to pay for substance abuse and mental health treatment, and that wasn't always the case. With the changes in the law and the Affordable Care Act and changes in laws in New York State, now if you have a private insurance company, they are also required to pay for substance abuse treatment and mental health treatment.
마약 중독자에 대한 처벌만 강조해서는 제대로 된 치료가 어렵다고 강조합니다.
We in Korea, we are kind of a little bit focusing on punishment for those who use drug abuse problem.
So 50 years ago in the United States, they had the same attitude. It was a moral problem. You were a bad person. And so treatment was send them to Lexington, Kentucky, and there was something called the narcotics prison. If you think of it as a medical disease, so imagine somebody who's a diabetic and you say, okay, you're taking your medication, your blood sugar is good, don't eat any donuts. And then they go out and they eat a dozen donuts. Condition gets worse because you relapse. You wouldn't treat that by punishing. So it's the thinking about drug addiction that has to change.
스콧은 마지막으로 마약 문제에 우리 사회가 좀 더 솔직하게 다가가야 한다고 조언했습니다.
Do you have any special advice for Koreans on how to handle drug problems?
Confront it honestly. It's a social disease, it's a psychological disease, it's a medical disease, and what we struggle with here in the United States for many years is we weren't honest about the problem, and so we didn't address it. It's a problem that is something that needs to be addressed honestly, and that people need help, not condemnation. We still struggle with that here.